Good morning, everyone. To my TOVA family, I am so excited to have a fantastic guest on our TOVA Health TV channel for TOVA Tuesday. As you know, that it is open enrollment for Medicare up until December 7th, and the options as far as having the opportunity to change your plan is here. But one of the things that I find that is very complicated, even as a healthcare provider, is what the bleep does my insurance cover? And let me tell you that it is something that I find very complicated as a healthcare provider. But today I have someone on our show that is an expert in really helping clients understand what their choices are, what their insurance covers. Now, the reason why this is very important, because did you know that medical bills debt is the leading cause of bankruptcy in the United States? And even if you have health insurance, you are not safe from medical debt. And some plans have high deductibles. So I want to welcome to our show today, Mrs. Cheryl Mongillo. She is the medical practice manager of several practices in Delaware, but she's also an expert on helping clients and families choose health insurance benefits to meet their individual needs. So today I want to welcome Cheryl to the show. Welcome, Cheryl. How are you today?
Thank you, Dr. Nina, for that warm welcome. And you are so right. Health insurance will make a sane person crazy. There are so many things and so much confusion, and you can't be expected to know. And it can be detrimental. And it really upsets me when people make the wrong choices just because they don't understand. So hopefully today we can answer some of those questions together.
And, today is just a very basic 101 show about what insurance coverages are. I think we just need to understand what our options are, what are the basics of insurance, and that would leave the opportunity for individuals to at least have a conversation with their primary care provider or consultants like you to make sure that they're on the right track, because it's such an important issue that we're facing, especially in these times of COVID and uncertain financial issues and economic opportunities for employment and cutbacks in employment. So this is very important that we get this right. But for all of you don't know that Mrs. Cheryl is a wonderful person inside and out, and she does a lot with the community as well. And so I wanted to let you know a little bit about Cheryl, that she grew up in Delaware like myself. I'm from Wilmington. Graduated from Wilmington University with a BS in healthcare management, and also an MBA from Wilmington University with an MBA in healthcare management. And we're both John Dickinson High School alumni. She's a class of 1983, I'm class of 1994. And I just don't know how she just does all she does, but crafting, she's entertains a lot with family and friends. I call her the hostess with the mostest, because I don't know how you're surviving in COVID right now, because you just love to be out, socializing, going to events, serving the community. And we also share a love for the German Shepherd breed. So I want to say welcome, Cheryl. And tell me a little bit, just let the community know a little about yourself a little bit, besides all of the hard work you do with managing practices.
So, well, thank you very much for that warm welcome. Yes, you're right. We are both German Shepherd fans. I have three, Eva, Evelyn, and Ace, two white German Shepherds and a black German
Eva.
Shepherd. Eva's my little pudge ball. She's a little fat thing, but they're the love of my life, except for my wonderful son and my extremely fantastic grandson. Never thought my life needed more until, you have a son, and then you think you're complete until you get a grandson, and then it's like, wow. So I'm super blessed with a wonderful family. They're very supportive and loving. And fortunately, they live close by, so I get to see them and spend time with them. And you're right, COVID is making me very crazy because I am a social person. I love interacting with the community. I love talking to people. I love helping people. And being stuck in my house has not been good for me.
I can say I've enjoyed it, but for you, I know it's a struggle.
Oh, no.
So let's just get right down to it. Let's start by what is Medicare and Medicaid? Because they're different types of insurances, right?
So that's a really good question and a great foundation. So people often confuse Medicare and Medicaid. So it's very important to understand that Medicare is a federal program that is for seniors and disabled individuals. Now, if you look on your pay stub, you will see a deduction. So people pay into Medicare the whole time they're working. So when people say Medicare is free, it's not. You've paid into that.
Mm-hmm.
And Medicare is what's called an 80-20 plan. So you might want to jot that down because we're going to refer to that a lot. An 80-20 plan means that the insurance pays 80% and you, the insured or consumer, pays 20%. So if the bill is $100, Medicare will pay 80 and you'll have to pay 20. That's a standard 80-20 plan. So Medicare open enrollment is right now. Once a year, you are permitted to enroll, change your plan, or do whatever you need for Medicare. Medicare, again, is for seniors age 65 and above, unless you have a disability. Now, Medicaid is very different. Medicaid is a federal and state-run program together. They actually share that. So while it's run by the federal government, it's a state program. So no one pays into Medicaid. It's not a deduction on your paycheck or any of those things. It is for low-income people. So what happens is if you don't have any income or you have low income, you can qualify for Medicaid. Medicaid is not an 80-20 plan. It is 100% covered. Okay? Two very different plans. The big takeaway that I need people to know is that if you have Medicaid, it is a state program. You cannot cross state lines with Medicaid. It will not be covered and you will get a really big bill, and it's not a good thing. Does that answer the question, Dr. Nina? Because that's a question I get very often.
Yes, I think you were very succinct and very clear that there are differences. Medicare is a federal run program and Medicaid is a federal funds that the state runs and manages people who are low income and need health insurance. And that's very important. But both of the plans, we as taxpayers pay into these systems. So I think it's important for people to realize that we as citizens of this country pay taxes, and those taxes and the resources are used for healthcare expenses on the federal side and also the state side. So somebody's paying for all of these healthcare services.
That is correct. So just to go off of, since we're talking about Medicare open enrollment, I'd like to just expand a little bit of what your options are with Medicare. Now remember, Medicare is for over 65 and folks with disability. You can't just say you have a disability and get Medicare. You actually have to be approved by Medicare, and it's a process. So you don't get to choose if you're disabled or not, just to let people know that. Mm-hmm. So Medicare also has what's called Medicare Advantage plans.
And I'm also going to put up this screen. Go. Keep
Thank
going.
you.
Mm-hmm.
The Medicare Advantage plans are insurances that have come up with a product that say, we can help you. Remember I told you that Medicare is an 80-20 plan? That means that you as the consumer have to pay 20%. The other thing I did neglect to tell you is that Medicare is not free. Medicare has a monthly fee that comes out of your Social Security check. And just as a reference, we're talking about Medicare Part B, as in boy. Medicare Part B is for outpatient services. That covers your doctors, your physical therapy, your therapist, all of the outpatient x-ray labs, everything of that is under Part B. And that's what we're talking about today. Medicare Part A is hospitalization, and we're not going to talk about that today, if that's okay with you.
Yes, ma'am.
So Medicare Part B actually is a fee. You pay $193 a month out of your Social Security, give or take, depending on your income level. And so it's not free. People often say Medicare's free. I need to emphasize again, Medicare is not free.
You're paying for it.
You're paying for it, and you're paying a monthly premium for it. Don't forget, it's coming out of your Social Security check. And if you're not collecting Social Security, you need to send Medicare a check every month. So Medicare was trying to figure out how to control costs. So they partnered with some of the insurance companies to come up with Medicare Advantage plans. And I'm sure anybody that's over 65 or 64 has been inundated with mail regarding Medicare Advantage plans at this point in time.
And commercials. I've seen a lot of commercials as well.
Correct. We can save you money.
Yes.
So, and people have said to me, Medicare Advantage plans are great. People have said to me, Medicare Advantage plans are horrible. And I say, yep, you're absolutely correct. And so they can be both horrible and they can be great. The part that's great is that they cover everything. So Medicare, the 80/20 Medicare, does not cover prescription drugs. You have to buy an extra plan for that. And remember, I told you about that 20%. That can be quite pricey. If you have a $100 bill, again, $20 every time you turn around, that's a lot of money. So you often have what's called a supplement, and you pay for a supplemental insurance, which covers the 20% and usually has a prescription plan attached to it, so you can get a discount on your prescriptions. But supplements can be quite pricey. They can run anywhere from $150 a month to $400 a month. So enter the Medicare Advantage plan. They bundle all that together for you. They say, we're going to cover you with your prescription plan. We're not going to charge you your 20%. And we're not even going to charge you your deductible. Remember, Medicare has a $184 deductible that you have to pay every January. So the Medicare Advantage plans say, we're going to give you this really cool plan, and it's not going to have any of those things. So
there has to be a downside to this.
That's exactly what my grandma used to teach me. She used to say,
everything can't be so great.
If it's too good to be true,
it's probably not.
Too good to be true. Exactly. However, it's not so bad as long as you understand what you're getting. And that's really the crux of my talk today, is to please understand what you're getting. The Medicare Advantage plans are great if you can't afford a supplement. Suppose you can't afford that $400 or that $300 for the 20% in the prescription plan. Medicare Advantage says, we'll cover you for the $193 and you don't have to pay anything else. Now, as my grandma says, what's the catch, mister? What's the catch?
What's the catch?
And the catch is, what's the catch? And the catch is, you have to follow the rules.
Oh boy.
Exactly. And the rules can be very complicated.
Yeah.
Very complicated. Medicare, you can go anywhere you want. You can see any doctor you want that accepts Medicare, and you end up paying your 20% and you move on. Medicare Advantage says, oh, hold on. We have a special in-network that you have to use.
So in-network means you have to use their healthcare providers that are in their network.
Absolutely. That is absolutely correct, Dr. Nina. And if you don't use their doctors, they may not cover any of the bill.
Oh boy.
So the first thing you need to do before you look at any Medicare Advantage plan is ask for the in-network list. You want to check, is your primary care doctor in-network? That's the first step.
Yes, very important. Because I get those nasty calls that say, you didn't tell me you were in network with this insurance provider.
Correct. Correct. So that's the first thing. The second thing is if you have a condition, suppose you have a heart condition and you see a particular cardiologist, you'll want to make sure they're in network, because otherwise you may have to change doctors. And if you have a relationship, you may not want to do that. So you really need to ask, who's in network? What does your network look like? Okay, that's the first thing. The second thing is what are the rules? Many of the Medicare Advantage plans require you to get prior authorization before you do anything. Remember, I told you Medicare, you can go anywhere you want. If I fall off the sliding board, not that I go down the slide very often anymore, but if I fall off the sliding board and bang my head, I can go and get an x-ray.
Just get a script and go get an x-ray, right?
I can.
Not so fast, right?
Not so fast with an Advantage plan. You better call your primary care doctor, you better get a referral, and you have to get approved for that visit. So, is that a bad thing? It actually helps control cost, because you know healthcare is is the biggest part of our GDP. So we really do need to start controlling costs. So is it a bad thing? Not really, if you're saving a whole lot of money. So you really have to figure out what's important. The other thing you want to do when you're looking at an Advantage plan is take your prescriptions and make sure that your prescriptions are covered. Because you don't really necessarily want to change your meds. If you're on something that's working, nobody wants to change that.
Absolutely.
So you'll want to make sure that that's on the formulary.
Right.
Many patients I've seen have had to change their medications because they're not on formulary. So that's a big piece. The other piece is that you must stay in network. So if you're a traveler and you go to Florida for 6 months out of the year, a Medicare Advantage plan is probably not for you, because you're going to be out of network and you may or may not have any coverage. Again, each individual needs to look at the things, make sure that it fits their lifestyle, make sure that it fits their pocketbook, and make sure that it fits the rules that they are comfortable with.
That is really good information, Cheryl, that you provided, because, you know, although Medicare Advantage plans make you go to their providers, it's also a way of controlling cost. But there's a downside, as you mentioned as well, and it's very important that our community understand that as well. And remember, open enrollment ends December 7th, so if you're not sure, you can always talk to your primary care provider to get some insight on your next steps. Now, Cheryl, let's just talk a little bit about some of the other plans. So, you know, if you aren't in a public insurance plan, there's also commercial insurance plans. So those are plans that your employer, or you get as if you purchase a private supplemental insurance policy. Those are like the Blue Cross, Blue Shield, the Cigna, United Healthcare. So tell us a little bit about those plans, because even in them, some of them you have to stay in network. Is that correct?
That is absolutely correct. Remember, I mentioned the most expensive thing this country has is healthcare. So everyone is trying to control costs. Everyone. The insurance companies are not in this to be philanthropic and insure everybody. They're in it to make money. So they do not want the cost to go out of control. So it's very important to remember in the back of your mind, everyone's trying to control costs. So years ago, we had HMOs, health maintenance organizations, and you had to go to those and you had to stay in the network and you had to do all that. Well, people got very upset about that. They didn't like HMOs. The insurance companies liked them a lot because they had contracted rates they paid, they knew what they were paying, and they could keep people out of where they, you know, were spending too much money. But they got a bad rap, so they changed it now to a PPO. So they changed the letters to make us feel a little better. But basically,
still got to abide by the rules, though.
You still got to play by the rules. You still don't get to do what you want when you want to do it. And again, I need to really emphasize that playing by the rules isn't a bad thing. The most important thing I can stress is get a good primary care doctor. Get a
Absolutely.
good doctor that will help you manage your care. A good doctor will give you order tests that are appropriate, necessary, and they'll be covered by your insurance. Get a doctor that you can have a relationship with. That is the key.
Absolutely.
Going to the hospital emergency room, going to the medical aid unit is called fragmented care, and it's just not good for anybody. The insurance companies don't like it. I don't really care what they like, but basically it's just not good care for you as a person. So
Absolutely.
that's my biggest piece. So back to our insurance thing though. So what you need to do is when you have a PPO or a POS, as they're now called, you need to, again, read the rules. Make sure you understand when you get that plan that you get the sheet, and it tells you if you have a copay, if you have a deductible. Now remember, if you have a deductible, that means that the insurance company doesn't pay for anything until you meet that deductible.
I found that out the hard way too. I didn't read the fine print of my policy, and I went to the pharmacy and I was very upset with that.
Dr. Nina, I am shocked. I'm shocked.
Yes, I was.
It's enough to give you, it'll cause heart palpitations.
Absolutely. It did.
So many of these plans have $6,000 deductibles. That's a lot of money. And remember, you have to pay that before the insurance company pays anything. So if you go to the doctor, you have to pay the doctor because the insurance company is going to put that towards your deductible. So many of the PPO plans, which are called preferred provider organizations, and again, that goes back to that in-network. As long as you stay in network and you take a PPO, there are plans out there that will have copays. And instead of a deductible or a high deductible, you may have a $1,000 deductible instead of the $6,000 deductible, but you have to pay copays. So when you go to the doctors, you have to pay $20. When you go to the pharmacy, you have to pay $10, $20, $30, $50. I don't know. Sometimes the copays are pretty high. So again, you need to look at the plan and you need to compare. You really need to compare what you're looking for and what you need. If you go to a whole lot of specialists, then you want to get a plan that covers copays for a whole lot of specialists. Wow. If you're really, really, really sick, you may want to get a plan that has a $5,000 deductible. You pay it once and then everything's covered for the rest of the year. So you really, again, it's that personal choice. You need to take your own healthcare needs, look at a historical year, what happened last year, not that that's indicative of what will happen this year, but at least give yourself some thought on that and figure out what it is that is best for you. There is no one size fits all.
Wow.
And people try to think that, and it's just not true.
Thank you, Cheryl, for that. I just want to say that it's really important to really try to keep up with your health care, and prevention seems to be key here. And as you said, that having a good relationship with your family practice doctor is key. Now, I'm going to play devil's advocate here. Now, there's some people that say, heck with the whole system. I'm just going to pay for concierge services. I'm going to pay out of pocket for having access to a good primary care doctor. Can you talk about these concierge plans?
So concierge plans are kind of new onto the market. And I always say that the devil's in the details. And every coin, every coin has two sides to every coin. So concierge medicine became popular when primary care doctors were felt overwhelmed and beat up. So they thought they were doing a whole lot of work and they weren't getting paid for it, which is absolutely true. They're the lowest paid docs and they do the most work. So they decided that they were going to offer their patients cell phone numbers, gold glove treatment, all of those things. Is it a good thing? Maybe. If you have something that's really, if you have a condition that requires a whole lot of maintenance and you can afford it, and you want to talk to your doctor on a regular basis, sure. But just remember, when you pay a concierge doctor, if you go get lab work or you go to a specialist or you go to the hospital, that concierge doesn't carry over there. Concierge is only private or primary care. So you're still going to pay quite a bit. You're still going to need insurance for all the rest of the stuff.
Wow.
So don't think that you're just going to pay that doctor $1,600 and be done, because that's not how it works.
And that's $1,600 a year just for the concierge service. That's correct?
That is correct. That's just so you can have your doctor's cell phone number and you can call him when he's on the golf course and interrupt him.
Yep.
That's really what
and he'll call you back.
And he'll call you back.
If that's important to you, that might work.
Again, I'm going to go back to everybody has different needs. And if that's a need that you have, and if you're an extremely busy person and you need to be able to call and have him talk to you or her right away and resolve your needs, that's okay. I would caution people again that does not mean you don't need insurance. That does not mean that you should not get another commercial plan or a Medicare plan. You still need to make sure that those things are covered.
So family, this is very, very complicated, as you see here. And I am not the expert in this at all, but I really want my clients, my patients to get access to high quality care. Remember, if you are over 60, 65 or over, or you're disabled, you can also go to the website at www.medicare.gov. And remember, open enrollment ends December 7th. So don't sit on this. Get moving. Talk to your primary care provider. Talk to an advocate at your senior center. Someone who is in the healthcare profession that can link you to resources, or to talk to someone that is advocating for you and your care, what's best for you and your pockets. So I definitely want to thank you for that. Any other thoughts on this? It's very complicated.
It is very complicated. And remember, this needs to be looked at every year. This is not something you do once and finish. Every year, as we, I hate to say it, age, although we age very well, Dr. Nina, I do believe.
Yes, yes.
Our healthcare needs change. Our priorities change. Where we are in the spectrum changes. So this needs to be looked at every year and reevaluated. And this is why Medicare has open enrollment every year. Once you're in, you need to look at it and make sure it's the best plan for you. And if you need help, find a resource. Find a qualified resource. Don't believe everything you see or hear on the newspaper or on TV. Remember, as seen on TV isn't really as seen. So just please be careful. This is a big, big choice and an important choice for everyone.
Thank you, Cheryl, for that. And as I said, this is very informative information, and I have learned a lot as well. But I want to say that, you know, I didn't want the show to be about doom and gloom. We know that medical bills can be very, very expensive. But what other options do we have to keep costs down?
So that's a really good question. And you really hit the nail on the head when you said we as taxpayers pay for everything, which is absolutely true. And I always laugh when they say the federal government's going to pay for this. The federal government doesn't have any money. We do. We as taxpayers need the federal government. So I think the real important thing is that we have to be responsible. We have to be responsible citizens, and we have to seek the right care at the right time at the right place. You kind of touched on preventive care, and people poo-hoo a preventive visit with their doctor once a year. But again, that's that relationship. If you go and have a visit once a year, your doctor knows where you are in your baseline, and then when something changes, they can catch things early. Early detection means less cost and less pain and agony for you. Remember, the earlier you catch something, the faster you can fix it. Kind of like a leak in your roof. If it's a little leak, you can put a bucket under it, or you can go fix those 2 shingles.
Mm-hmm.
Otherwise, you're going to end up fixing the whole roof.
And that can be
So,
very expensive, I know.
correct. But 2 shingles may be pretty cheap.
Yeah. Mm-hmm.
So I think it's important that people are responsible. And I always cringe when people go to the emergency room. First of all, the
Absolutely.
emergency rooms are crowded. You're seeing a doctor that doesn't know you. They don't understand your history. They don't know if your temperature is usually 98.9. Maybe that's your normal, but your
Mm-hmm.
primary care doctor knows that.
Right.
And then you go and you expose yourself to all these other sick people, and you're there for hours and hours, and it's extremely expensive. So to be a responsible consumer, you go to the right place. You have a sore throat, you go to your primary care doctor. You have a finger that needs a stitch or two, you go to your primary care doctor or medical aid unit. Again, we as consumers need to understand that we don't need the highest cost thing. Sometimes an x-ray is perfectly sufficient instead of an MRI. I always hear that. I need an MRI. Did you get an x-ray yet?
$3,000 MRI.
Right. $3,000 MRI versus the $12 x-ray. And we see the exact same thing.
Yeah.
So
Yeah.
ask questions. Again, when you're with your doctor, ask questions. Is this the only opportunity? Are there other care plans that I could try? Is there something else I should be doing? What should I, as the consumer, be doing for my health? Remember, you need to be responsible for your own health. And with that will come decreased costs, decreased usage, and I really do think that's the big piece. And I think we'll be happier. I don't really like being poked and prodded. And when you go to the ER, they run every test just to make sure they didn't miss anything. Well, that's great, except I don't want to be there for 10 hours.
Mm-hmm. And I wouldn't want to be around all those sick people, especially if my immune system is compromised.
Precisely. I absolutely agree with you.
So, I always ask some tough questions as we sort of close down a little bit. I had Dr. Stephanie Malleus on our show, and we talked about aging in place with dignity. And one of the things she said was that if your neighbor is sick, that impacts you. Do you think our community really understands that? Because it's easier just to say, oh, well, that's not my problem. But actually it is. How do we get our community to shift our minds to say that we have, as a collective society, take more responsibility for making sure that we can get access to high quality care, but we have to look at controlling the cost, because spending 16 to 17% of our GDP on healthcare is not sustainable.
Well, that's an understatement. That is absolutely correct. And Dr. Malleus is lovely, and she's absolutely correct. She's absolutely correct that we do need to do the whole community thing. Again, I have an elderly neighbor across the street from me, and I check on her, because if something happens to her, I don't necessarily want the paramedics coming and taking her away to the hospital when all she needs is a ride to her primary care doctor. Mm-hmm. So I think that the more that we engage with each other, the more we learn from each other, the more we share, and it actually makes you feel good. Mm-hmm. It does me. When I do something nice for somebody, I actually feel better about myself. It's kind of selfish, I know, but it actually makes me feel better. So I think you're correct. As a collaborative group, we need to be more cognizant of who's in our neighborhood, what's happening. If with COVID, this is a perfect example. I mean, we need to know who else is sick and how can we help them and what can we learn from them. So I think that we really need to be able to offer more assistance. And even the mom with the 4 children who's trying to work 2 jobs, maybe she needs a little bit of maybe one of the kids needs their shots and she can't get them there. Again, it takes a village. It truly, truly does. And I think that's very important for both ends of the spectrum.
Thank you so much for that. And I do want to say that I'm very fortunate to have a primary specialty care clinic inside of family medicine practice, in which even with my sickle cell clients, we really try hard to keep our patients out of the emergency room. Even though they may have a crisis, we can manage them and have them stay at home for most of the cases. So it is possible. But also talk about what some other unique programs and services that are offered at Family Medicine at Green Hill in this patient-centered medical home.
So I'm very fortunate to call Nina a colleague, and we do have a lot of cutting-edge things here at Family Medicine at Green Hill. We have a licensed clinical social worker here to help people navigate those difficult times, whether it be a parent who's suddenly suffering from dementia. How do we manage that? Do we age in place? Do we have to look for a facility? You know, she's absolutely wonderful with being able to help navigate those kinds of things. We offer care for infants all the way to seniors. We have a home visit program where we actually have someone that visits patients in their home, again, to get that important care. Because with COVID, it's been very, very important to manage your care. Don't let things get out of hand. Remember that roof that we didn't fix, then now we have to replace the whole roof? Well, if you have diabetes or something else and you start to go off your norms, get it early. Catch it early. Make sure that you're getting the care you need quickly and efficiently before it becomes a bigger problem. The other thing we offer here is chronic care management. We have a team of 5 nurses, and those nurses reach out to our patients. How are you doing? How are things going? They make sure that they have prescription refills. They make sure that their prior authorizations are completed timely, and they're there to answer questions. If a patient calls and says, I took my blood sugar today and it's very, very high, okay, let's talk to the nurse. Let's see how we can do this. Again, don't really want you to go to the ER because that's probably not a good place for you. You're already compromised. You don't need those germs. Let's see how we can manage you. So here we have a whole lot of things that we try to keep our patients happy, healthy, minimize their copays, minimize their payments, and keep it reasonable.
And I also want to mention that you also offer telemedicine visits, which you have done for 3 years, because that is also a way in which nurses can triage any kind of concerns or issues you have, and they can make sure that you get care at the right place, the right time, right?
Correct. That was on my list. I missed that one, but you're absolutely right. And while everything is not appropriate for telemedicine, it's a good starting point. The doctor could evaluate you and decide whether you should go to the medical aid unit. The other thing that we offer here is that the doctor could say, you know what, you need to see a specialist. We can make that appointment now and get you in quickly. So again, we do that whole coordination of care. We make sure that we understand you, we understand your needs, and we understand your health conditions. And telemedicine is a wonderful, wonderful thing, especially for folks that aren't comfortable leaving their house.
Thank you so much. Again, I want to thank you. Thank you so much for sharing such important information to our community. In closing, if you could fix one thing about our healthcare system, what would it be?
I would make it so people, this is really crazy. I would make it so people understood that it's not free, that everything has a cost, and that everyone is responsible. And I think that's the one thing that we haven't done a good job of. Between Medicare, Medicaid, and the commercials, people don't understand that ultimately they are responsible for healthcare costs. And until we understand that we're spending our own money, I don't think we're going to get any kind of help.
Wow. Wow. Thank you so much for that. And again, it starts with just a village of people that are like-minded and want to move forward a particular agenda. And I think that we're on the right track. I really do. I mean, even in all these unprecedented times, we have such a wealth of experts that really want to see our healthcare improved. And I'm very encouraged to say that there are places even in Delaware today, that are really providing that type of model that people need. And I would say family medicine at Green Hill serves close to what, 7,000 patients now? And they
Yes.
even serve patients with sickle cell. And we treat everyone the same. We give everybody access to the same high quality care. It can be done. Would you
Yes,
say that?
it can be. It can be done. Again, as a team, we can make anything happen. So, and I hope all of your followers, listeners understand that as a team, it can happen. They need to be educated. They need to understand. And if they don't understand, they need to ask questions. That's the big thing. Ask questions. Don't assume. Ask questions. Ask questions of your primary care doctor. Ask questions of your insurance carrier. Ask questions.
Thank you, Cheryl, for coming on our show today.
Thank you for having me.
I am just so, I'm more motivated now and inspired to help my clients, that you have given me so much information to really be able to advocate for my clients to make informed decisions. But we recognize that insurance, and I do, it's sort of like having a college degree in healthcare management just for the insurance side. Public policy, rules and regulations constantly change. Is there any way that people can get in contact with you? Would you like us, TOVA Community Health, to share our email address? And if they want to contact you, we can forward that information on if they need a personalized consult?
I would be happy to do that. So if you have somebody out there who is really struggling and just doesn't know what they're doing, please, again, ask questions. Happy to help.
Thank you so much. Again, I want to thank you. I'm Dr. Nina, Executive Director of TOVA Community Health today, for taking your time to really be able to take such really good information about insurance coverage. Please be encouraged that there are many good people in the community that are willing to help you and want to make sure that you're on a path to optimal health and wellness. Thank you again for joining us on TOVA Tuesday. Remember, you can like us at Facebook or Instagram at TOVA Community Health. For more information, you can go to our website at www.tovacommunityhealth.org. And like I said before, if you have any questions, please go to our website, leave a comment or any question that you have, and I will assure you that my team will get back to you and make sure that we link you to proper resources in the community that can help you. Remember, if you need a primary care provider, we are here for you as well. You can call us at 302-429-5870. Remember that all of these episodes we bring to you. So if you really like the content, make sure that you donate to our Cash App at TOVA Health with the $, or to our PayPal account at contact@tovacommunityhealth.org. I want to thank Cheryl again for appearing on TOVA Tuesdays. I hope that you are more inspired and have at least a little bit of knowledge to make an informed decision. And remember, get help from experts that can lead you in the right direction. Thank you, Cheryl, for
Thank you, Dr. Nina.
today.
Thanks so much.
Thank you. You guys have a great day.